vaginal prolapse, or just to remove benign tumors in the uterus. It's called fibroids. Now, the surgeries to avoid, it's definitely a not absolute term. There are always situations surgeries are beneficial or necessary, such as in cancer, in life-threatening situations. Hysterectomy is also performed a lot of times right after delivery of baby, when there's a lot of bleeding. So that could be life-saving.
Sure.
So there are different situations. Now, but the majority of them are performed for elective reasons. This is the kind of procedures we're talking about. For the elective reasons, it's usually for fibroids, which can cause pain or bleeding.
Okay.
And for endometriosis, another pelvic pain, it doesn't even always take the pain away. For endometriosis. So a lot of this is for discomfort and inconvenience reasons rather than life-threatening reasons. So why is it not necessary or not the best thing to have the uterus removed? Well, first of all, sometimes, because ovaries are sometimes part of the procedure. If the ovaries are removed, you actually lose the natural source of hormones, such as estrogen and testosterone. So when you have no natural source of hormones, obviously your life is going to be affected in a deep way.
You probably already have this to talk about, so if I'm jumping the gun, tell me. But sometimes we are throwing the baby out with the bathwater. And sorry to be talking about the reproductive system when I talk about that. But
it's totally relevant.
Yeah, I think so, because now you don't have the organs that are creating those hormones. You go into a whole different area of therapy now with hormone replacement therapy, and that can cause cancer in and of itself.
Absolutely. And without the hormones, the cardiovascular risk goes up. The osteoporosis risk goes up. So there are a lot of problems with that. So that's one reason, why the surgery has more risk to consider.
And if I could comment even further on that this is why it's so important what Dr. Lee has presented to us, is that if you're getting a hysterectomy for convenience reasons, as opposed to a life-threatening situation, you're putting yourself into what was not a life-threatening situation, into hormone replacement potential.
Sometimes that means deeper water.
Yeah, that's what I'm trying to say. You're jumping into deeper water, you might as well just stay in the lighter water where you can swim.
Well, the intention is good, because we don't want you to be inconvenient or having pain, or having discomfort, but sometimes you want to think twice about the deeper water you might be getting in, because you didn't, most people don't know that when they go into surgery.
Yeah.
And this is kind of interesting to talk about why the doctors are doing so many hysterectomies.
Correct, because it's one hand feeds the other.
That's right. Why do you think they're doing so many of them?
Just ask that big question.
Well, I think most doctors mean well, but they do live in this system.
Well, let me give you an example. I'm a person, and so I have to just close my bias here. I believe, I'm a religious person, and I really feel that some people don't believe that religion has created a positive impact on the world, but I feel that it has. There's some downs and there's some pros. But with religion, sometimes you get into a situation where things religiously are really centered around getting money donated through the collection plates, other types of things. So they have good purpose in their heart. They want to do the right things, but sometimes systemically nobody questions why they're doing what they're doing when the end goal is to get some money into the plate.
Right. I think you got a point there. I don't even think that's the primary point. I think they're taught in medical school the way it is, and logistics system forces a lot of decisions.
Yep.
And convenience for them too.
And
You know, if
in a
they've
way-
done everything they can for
Mhm.
you surgically, you know, like what else is left there? There's nothing they can do, right?
Sure, and I think that's in what that's what I mean by systemically, the whole system supports the move. So in other words, the water flows where the money flows, and people stop questioning that flow, including the doctor who has a good heart.
Absolutely,
Yeah.
absolutely. And the other side of it, I believe, with the why the doctors are doing it is because there is no better treatment for it. And also, the side effect or problems that can occur after hysterectomy are not as recognized in the Western culture as
Mhm.
much as in the Eastern culture.
Right.
Because when I Googled, searched side effects of hysterectomy,
Mm-hmm.
the results I get are very limited. It's mostly related to surgery or anesthesia, like infection, bleeding, and
Oh,
allergic
really?
reaction.
Oh, that's
allergic
an-
reaction to anesthesia. Oh yes, the hormone thing. If ovaries are removed. But if I also Googled in Chinese.
Okay, much different.
Oh yeah, the side effects can be related to constipation,
Mm-hmm.
urinary discomfort, urinary dysfunction,
Mm-hmm.
sexual dysfunction, premature hormonal dysfunction. This is related to the ovaries, and unexplained pain and discomfort.
Wow.
The theory in the Chinese medicine is, you know, you have a space that is empty now. So all your internal organs, guts, you know, they're moving to fill that space. So your normal anatomy is somewhat distorted.
Sure.
And when you have surgery, it's a trauma. It's a injury. The nerves are connected. That's why the sexual dysfunction happens, because some nerves from perineum is connected with uterine. Even the blood supply sometimes are interrupted between the uterus and ovaries.
Interesting.
So it is not as simple as a mechanical part, like, you know, like from the car. You just take it down because it was screwed on, now you screw it off. It's not quite like that.
I could see that being the case.
So, you know, go back to saying that the surgery is the void. That is not absolute.
Yeah.
There are situations, you know, you've had cancer, you have things that's damaging your health, you always weigh the risk and benefit. There are absolutely situations you do want to have the surgery, but for those majority of the time, actually, according to the statistics, the 70 to 80% of the time, it can be avoided.
Right. And I also wanted to say that you're not going to, it's not a guarantee you're going to get cancer if you use hormone replacement therapy, but the temptation to move into that direction is very, very high when not enough, even on Google, is talked about that your hormones are not as balanced as they used to be.
Right. You want to click
Oh.
the window? Yes. So what do you do if you want to try to avoid surgery, but solve those discomfort and pain and inconvenience of excessive bleeding? Sometimes that can cause anemia and being tired,
Mm-hmm.
and you know, pain and discomfort. So there are a lot of things can be done. I strongly recommend Chinese herbal medicine and acupuncture. I do know the treatments are very effective in treating painful periods and abdominal bleeding.
I would go with that recommendation as well.
Right. Related to hysterectomy and you know, the problems or painful periods, I want to give the first tip, healthy tip, natural health tip of the day,
Mhm.
which is how to relieve painful periods.
Okay.
And this one is very, very simple and interesting. I try to find the simple ones that actually people can use.
Sure.
You know, we have what we call auricular acupoint
Okay.
map, basically in the ear. the whole body is represented there, the whole system, the whole body system is represented in the ear. When you are trying to treat certain areas, you can either find a point to stimulate or you can just stimulate it all. So this is using alcohol, like rubbing alcohol to rub your ear, the ear, the outer ear. Either that, or you can just soak the alcohol in the cotton ball. Soak the cotton ball in the alcohol.
Okay.
and slightly squeeze it so it's not too wet, and then put it in your ear.
Oh.
So the alcohol will stimulate all these areas and promote better energy flow, and hence relieve painful periods.
Very good.
Very simple.
Yeah, that is very good. I'm gonna, well, it looks like we're about to go to break. I'm gonna squeeze another one in there. I was reading up on wheatgrass, juicing wheatgrass. And this is related, is that if you have heavy periods, meaning that you're losing a lot of blood and so you may be going a little bit anemic, wheatgrass actually helps to rebuild the blood supply.
There are so many things in herbal medicine and acupuncture. I can't even name all of them. There's also moxibustion to a point in the big toe that will stop heavy periods.
Oh, great.
Very effective. So besides everything you do in Western medicine, look into that.
Excellent.
So when we come back, we're going to continue to our second surgery. Hopefully we can try to stay away from. Don't go far away. This is Dr. Tong Lee at Ageless Living at Voice America World Talk Radio.
And this is Kurt Wilhelm. Don't go away. We'll be right back with a lot of information that might possibly even save your life. So we'll be right back. Thank you.
So I have 5 diseases,
Mhm.
but I'm only planning to talk about 4.
Okay.
So this makes it easier. You know what this is, right? Episiotomy.
No.
This is the cut.
To
for
help the baby
deliver.
come out.
Yes.
Yes.
And this is angioplasty, and this is heartburn surgery.
Okay.
In the lower back pain, we're not going to mention the name. The next show is on that.
Oh, okay.
So,
Okay, great.
so each section would stay with one, but there's so much to talk about.
Okay.
Either each one of them. So we'll just stay one quarter for each.
Okay.
Each one is going to have a tip,
Okay.
and this we're only going to mention it for next time.
Okay. That sounds good. Okay.
It's so much easier to talk to someone, right?
Oh, it is. I went the whole hour all by myself on the last one, and I was like, whoa! Thank goodness I didn't pick something I knew what I was talking about.
You can talk. I know that. But it's just more intriguing. It's just more interesting.
Yeah, it stops the monologue.
Yeah.
Yeah. Yeah, you bet.
So this is probably the shortest subject.
Okay.
You know this exercise, right? Kegel.
No.
Kegel. It's tighten your floor of your pelvis.
Oh. Oh.
Suck your suck it in.
Right, as if you don't want to go to the
How do you
bathroom,
pronounce that? Yes.
It's K-E-G-L-E?
E-O-S.
Oh, Kegels.
Kegels. It's
Kegels.
very famous.
Oh. And oh, so then you don't need the episiotomy.
Huh?
Then you don't need the episiotomy. That's right. The
Well,
idea
no,
is-
it's just one thing to do.
Oh, to help it.
But-
I got you. Now, is that to reduce it or to? That's for helping the baby out, right?
Helping the baby out.
Okay. Welcome back to Ageless Living, where you learn all of the secrets about how to create a balanced, healthy, and beautiful life, both on the inside and the outside. And speaking of beauty, we want to thank our advertisers on the show. We couldn't do it without them, and nor could we do it without our amazing listeners. So we would recommend that you take advantage of the free consultation offer from Arizona Laser and Skin. If you go to azmdlaser.com, you can find all the different services that they provide there. They range all the way from holistic services like acupuncture to skin and laser treatments for your skin, all the way through to full cosmetic surgery. So I'd recommend taking a look at those options there. And they always will give you holistic and simple options before they recommend the full cosmetic surgery. But if it's something you need, they're some of the best.
Absolutely. And I also recommend you to send me an email if you have any questions or comments on our health tips.
Mhm.
Love to hear the feedback. The email is tongli.md@gmail.com.
Excellent. Yeah, some feedback with the health tips or feedback from anything, or even if you want us to, if you have suggestions for future talk shows, we can always listen to our listeners in that respect as well. So now we're talking about the different types, the most often are unneeded.
Overused.
Yeah, overused, the most overused surgeries, and this one is a little bit personal, so I'll let Dr. Lee broach this one.
Right, this one is called episiotomy. This is a procedure that where with childbirth, to facilitate babies to come out, actually this procedure is performed to cut the birth canal outlet so the baby will come out easier. The idea is that this would avoid deeper or tearing and facilitate the baby to come out. Actually, over the time, studies have shown that this causes as much problem as it prevents. So the benefit is sometimes there, especially during emergencies. You know, if the baby is not doing well, you really need to get the baby out, or the baby is extremely large, it's still beneficial because a tear heals much worse than the cut. So that's the whole
How it
theory,
originated, yeah.
how it started, yes. But it is just overused in situations that are not necessarily warranted. So I think there are studies and since shown this result, and the American Gynecological Obstetric Association, I think made the new recommendation that episiotomy should not be routinely done. So since then it has been slightly reduced, but it's still considered overused. So the interesting thing is there was a survey on the young moms. They were asked if they had a choice, or if they were asked to have a choice to decide if they were to have episiotomy. About 75 to 80% of them didn't believe they had a choice.
Wow.
So education is a big part of it, and this should be talked about way before the delivery time. So it's good to bring up the public awareness to have this all planned out way before the delivery. So episiotomy, why is it just as harmful as it could benefit? Is because it is deep. It cuts the muscles.
Oh.
It cuts all the way through. It's not just the skin. So it can cause complications and consequences.
That's a misconception. I think a lot of people think it's just the skin, so
No,
they think it's harmless.
not.
Oh.
That's why it can cause long-term problems like discomfort, scarring, and incontinence. So so it should be carried out, or it should be thought of, decided with careful consideration. So there are certain situations would benefit than other. So this is a procedure that should be people should consider to hopefully avoid.
And also, if you brought up the other side of this too, the selfish side.
The what side? Which side? Selfish side?
There are husbands who have complained about it as well.
Of course.
Yes.
Yes, of course. That could be, cosmetic or comfort or sexually.
Yeah, they feel that in bed it's not as fun as before. So, yeah.
But what do you do to facilitate the delivery to avoid this procedure?
Yeah.
There are exercises you can do. first of all, make sure you don't have diabetes during surgery, during pregnancy, because diabetes will produce larger babies.
Oh.
Usually when you have gestational diabetes, the babies tend to be very large, and it's very difficult to deliver those babies without episiotomy, sometimes C-section.
Mhm.
So staying healthy and, during the pregnancy is a first step. And then doing exercise relaxation and learning the relaxation skills is another one, a Lamaze class. And Kegel, how do you say this exercise?
Yeah, Kegels. Exercise.
Kegel's exercise is very, very established exercise of the pelvic muscles. So when you do have stronger muscle to push, then you have better chance of delivery without external help or surgery. So that's one exercise that's wonderful to have. Actually, I teach my kids.
Hmm.
They're teenager boys to do the Kegel exercise.
And what are the benefits for boys?
For one,
Uh-huh.
it helps to prevent what do you call that? Anal rectal problems such as hemorrhoids
Oh, okay. Mm-hmm.
or prolapse. In Chinese medicine, we believe in qi, or positive energy, goes down with aging. So as a teenager or as a healthy young person, you don't think about these things. But over decades of time, when we age, hemorrhoids are very common. And it's something that's not going to kill you,
Mm-hmm.
but it can be very bothersome. So if you can exercise, if you're driving, if you're sitting at a red light, exercise. No one will know.
I do grab the steering wheel and do chest exercises in that same way. But
if you think about it, I was listening to, I think, TV. They were
Mhm.
talking about average woman every day spend 55 minutes in preparing themselves, makeup, to look better.
Oh, sure.
Every day.
Wow.
I think that's 14 days a year.
Okay.
I think.
Okay. You combined, that's 14
Yes.
days of their life they spend.
Plus the time we are waiting in line,
Mhm.
waiting for microwave, waiting for somebody, waiting for the red lights. There's a lot of time we can utilize
Very good point.
toward our health.
Mhm.
And this one, no one knows you're doing.
That's right.
So, to just describe the exercise, it is tightening your pelvic muscle, anus, like when you're trying to not go to the bathroom.
There you go.
That's a
good
simple way to put it. And ideally 50 to 100 times, if it's brief exercise. If it's longer, I guess you can cut the numbers, but the more the better. The stronger muscle, just like any muscle, if you exercise it, it gets stronger.
Very good.
With the episiotomy, I think, the idea is the tissue cutting is deep. So a lot of people don't know that. When you say people don't know that, it's because I guess we don't talk about it beforehand.
Mhm.
So ask your doctor and discuss it ahead of time, and involve yourself in all forms of exercise, and healthy pregnancy is the best way to go.
You bet. And I do need to give that disclaimer on everything that we talk about. We always want you to just consult with your current doctor, and also to consult with a second opinion, preferably with a holistic doctor who is a full, maybe somebody who's an MD and a holistic doctor at the same time.
Right. The third procedure, this is going to be very controversial, I think,
Mhm.
is angioplasty. It is overdone.
Mhm.
1.2 million angioplasties are performed every year in America.
Mm.
It's a lot of angioplasties. And this is a procedure, just to describe what it is,
Mhm.
where through the blood vessel, the surgeons will insert a balloon to open up the clogged arteries in the heart
Mhm.
and leave a stent, which is a wired cage,
Okay.
in the vessel to keep it open. So that sounds good, doesn't it? Doesn't it sound like it's gonna work well to unplug the clogged arteries?
Sure, it sounds good, and my doctor says it's
Same
good,
thing,
right?
it sounds good mechanically.
Uh-huh.
And, you know, actually there's a groundbreaking study of 2,000 heart patients.
Mhm.
The article was published in New England Journal of Medicine that showed the results of angioplasty success is equivalent to medical management. Since that study, you know, we were looking at angioplasty a little differently.
Mhm.
And we'll talk about why and how, because it sounds like a good procedure, why not? So
Right.
when we come back, we'll talk about that and what you can do by yourself to avoid those procedures and avoid having cardiac problems.
I think that's my biggest frustration of all, is that they act like that's the only option. So when we come back, we'll talk about other options as well.
Absolutely. Don't go far away. This is Dr. Tong Lee at Ageless Living at Voice America Word Talk Radio.
And this is Kurt Wilhelm. Don't go away. We'll be right back after this break.